So hello friends, welcome to my new video. So this video is the continuation of my previous topic that is corneal transplantation. So today I will discuss with you all about Descemet stripping endothelial keratoplasty or DSEK. So previously I uploaded video on DELK. So today I will discuss on DSEK. Okay. So let's start. So DSEK is the procedure that replaces the innermost layer of the corneal rather than replacing the entire cornea. So here the disease endothelium is removed with the healthy endothelium of the donor tissue. So here patients with endothelial dysfunction causing visual loss or visual disability in the form of glare or fluctuating vision affecting day-to-day activities such as reading, writing or driving are the suitable condition for this endothelial keratoplasty. So here there is a confusion is there in among learners between DSEK and DSEK and DSAEK. So these two processes are quite similar to each other. Just the difference is how the donor cornea is placed to the eye. So DSEK or DSEK involve a transplant of the back layer of the donor cornea into the patient eye, and DSAEK is the automated version of this procedure which uses machine to cut the tissue. Okay, so here these are the indications for DSEK, where first of all Fuchs endothelial dystrophy. So this is one of the most common indication for DSEK. So here Fuchs endothelial dystrophy is a progressive disorder where the endothelial cells of the cornea deteriorate, leading to corneal swelling because the endothelium pump mechanism do not work properly. So that lead to reduced vision and discomfort. So DSEK is often used to replace the dysfunction and endothelium, and it restored the corneal clarity. Now, if I say about the pseudophakic bullous keratopathy, so this condition occur as a complication of cataract surgery, where the corneal endothelium become damaged due to factors such as prolonged intraocular um, lens implantation or intraocular surgery complication. So this DSEK can be used to treat pseudophakic bullous keratopathy by replacing the damaged endothelial cells. Other causes of corneal endothelial dysfunctions, like here, DSEK may also be indicated for corneal endothelial dysfunction caused by trauma, infection, and other corneal disorders. So this condition can lead to corneal edema or decreased vision and discomfort, which can be improved with DSEK. Now, if I say the previous corneal transplant failure, so in case of where previous corneal transplant, which is such as penetrating keratoplasty, has failed due to endothelial rejection or other complications. So DSEK may be considered as a secondary procedure to replace that dysfunction graft. And if I say about the improved visual outcome, so here DSEK is often preferred in case where the preservation of recipient corneal architecture is desirable to achieve the better visual outcome and minimize the post-operative astigmatism compared to penetrating keratoplasty. So in this kind of cases, this can also be one option for them. So it is important to note that the decision to undergo DSEK is made based on the individual patient factor, including specific corneal condition. So the extent of this endothelial damage to the patient overall ocular health and surgeon expertise also depend here. So therefore, a comprehensive evaluation by an experienced ophthalmologist as well as an optometrist is very much necessary to determine the most appropriate treatment for each and every patient here. Now, if I tell about the contraindication where DSEK cannot be performed, so here conditions, corneal conditions where requiring full thickness grafting. Like DSEK is not suitable for corneal conditions that affect deeper layer of the cornea, such as significant stromal scarring or keratoconus with extensive stromal thinning. In this kind of cases, procedures like penetrating keratoplasty is more suitable or more giving good result if I then DSEK. Now, significant anterior segment pathologies like patient with significant anterior pathologies such as iris abnormality, severe corneal neovascularization, or anterior chamber abnormality may not suitable condition candidates for this DSEK due to the increased risk of intraoperative and postoperative complication due to this DSEK surgery. Now, if I say about the glaucoma, so here patient with active or ocular infection inflammation may need to have this condition resolve before undergoing DSEK or reduce the risk of graft failure. And if I say about the glaucoma cases, okay, so here patient with glaucoma who are having uncontrolled intraocular pressure may be at increased risk of intraoperative or postoperative complications such as graft dislocation or failure. So this patient may require additional management of their glaucoma before considering DSEK. So IOP should be in normal limits. So then only you can perform this DSEK surgery to the patient. Now, patients who have unrealistic expectation about the outcome of this, such as expecting perfect vision or rapid recovery, may not be suitable candidate. So, it is important for patient to have thorough understanding of the potential benefits and limitations of the procedure. So, if I say also about the patient with systemic condition that may impair wound healing, such as uncontrolled diabetes or collagen vascular diseases, may need an ideal candidate for this defect. So, due to the increased risk of graft failure and post-operative complications, so here patients who are unwilling to comply with post-operative care instructions such as using topical medication, maintaining a specific head position, they are not doing that properly. So they are not suitable candidate for DSEK. So it's very essential for patient to undergo a comprehensive evaluation by an experienced ophthalmologist to determine the suitability of the DSEK. So here, definitely you should discuss these pros and cons of this DSEK surgery. And if the patient having contraindication, then first of all, do try to mitigate this contraindication first and then go for the DSEK surgery. So sorry for the interruption. So this is how surgery is performed. So here, first of all, here preparation. The patient eye is evaluated to determine the extent of endothelial damage and need for transplantation. So similarly, a suitable donor cornea is identified and prepared properly. Then after that, the recipient cornea preparation. So here a small incision is made in the cornea typically in the periphery to allow access to the disease endothelial layer using a specialized instrument, and the surgeon remove the disease endothelium along with the decimate membrane, uh, leaving the rest of the layer intact here. And after that, the donor tissue preparation begins. So here, a thin layer of donor cornea containing a healthy endothelial cells and decimate membrane is prepared. So this donor tissue is usually obtained from eye bank and is selected to match the size and shape of the recipient corneal defect. Now, after that, the graft insertion is done here. So here, the prepared donor tissue is folded, inserted into the anterior chamber of the eye through the surgical incision, and once it is inside the eye, the donor tissue is unfolded and positioned over the recipient cornea. And air bubble placement is also very much important here. So an air bubble is injected into the anterior chamber to push the donor tissue against the recipient cornea, promote adherence to the cornea. So the air bubble also helps in the positioning of the donor tissue during the early stages of healing. So post-operative care, so after the surgery, the patient may be advised to maintain a specific head position or facilitate to attachment to the donor tissue, and medications such as antibiotic and corticosteroid are prescribed to prevent infection or inflammation. So regular follow-up visits are scheduled to monitor the healing process and assess visual outcome. So this DSEK offers several advantages over the traditional penetrating keratoplasty. So include this faster visual recovery, reduced risk of graft rejection, and better preservation of the corneal integrity. So additionally, see, this DSEK is associated with fewer post-operative complications and lower risk of astigmatism compared to penetrating keratoplasty. So however, this DSEK requires specialized surgical skills and may not suitable for all cases of the corneal endothelial dysfunction. So that is why it is very important to evaluate the patient properly before going to the decision that you are going to do this to this patient. So that's all, friends. Thanks for your. Please don't forget to like my video, subscribe to my channel. I hope this video helped you a lot in understanding the procedure